The World Health Organization is holding an emergency summit in Ghana in an attempt to get a grip on a growing Ebola outbreak in Western Africa. This particular strain is especially deadly, killing 90% of patients. Record numbers are dying, and as Stuart Greer explains, medical officials are struggling desperately to contain the outbreak.
It is a terrifying disease, so perilous to treat that medical staff must wear hazmat suits. But sometimes that isn't even enough protection. The latest Ebola victim at this Liberian clinic is a nurse.
Oh goodness, she's bleeding a lot.
She caught the virus from a patient and is now bleeding profusely. She knows all too well her chances of survival are only about 10%. By the time a patient makes it to this high-risk ward, it's a virtual death sentence. The outbreak began in January in a remote corner of Guinea, but has since spread to cities and across borders into Sierra Leone and Liberia.
The outbreak in West Africa is unprecedented in the history of Ebola outbreaks because it involves 3 countries at least, capital cities, multiple sources, and that will make it far more difficult to control.
Discovered in Zaire in 1976, the Ebola virus can cause gruesome internal and external hemorrhaging. The victims slowly bleed to death. There is no vaccine, no cure. All doctors can do is keep a patient comfortable and isolated so others aren't infected. This river separates Liberia from Guinea. The virtual non-existent border explains why this outbreak has spread so fast. As health ministers from 11 African nations hold emergency talks with the UN, medical officials struggle to confirm new cases and deaths. But these are countries with few resources.
We are calling on the international community to come and support the ministry. Right now, we can't do it now, we need the international support.
Without international help, the number of deaths will only rise. The bodies of the latest victims are taken far away to remote fields, every step sprayed with disinfectant. They are laid to rest in unmarked graves because few here want to admit to an Ebola death in the family. Instead, strangers do this dirty and dangerous work, their medical clothing buried along with the dead. Stuart Greer, Global News, London.